So we're out here outside Planned Parenthood in San Francisco doing our normal sidewalk outreach. Got my cup of coffee and my brochures here that hold dozens of resources for families in need. And you know, the website also points to several dozen additional resources, and that site is bayareareproCare.org, bayareareproductivecare.org. We're so grateful to be able to be in the position to help people and connect them to the resources just by doing normal pamphleting, brochuring out on public sidewalk. And all the hate that we get for it, that anyone across the country gets for this sort of activity, that people in other countries like Britain get jailed for, is just simple outreach, helping people out. And the only reason for the hate added on top of it. Good morning, sir.
Good morning.
And that's medical waste pickup, of course. So the reality of the harm being done in our community is very real. I was hoping to be able to get that on camera because the past 2 weeks when I've noticed this vendor that operates through Zeba Fleet Services, I wasn't able to get the main observation on camera, just the car once the medical waste was already loaded up. But that was the first time I was able to get the red biohazard bags on camera. So, yeah, as I was saying earlier, the hate that's given to pro-lifers for public sidewalk brochuring, pamphleting, is just because of the message. It's nothing that we do outside of Planned Parenthood that's out of the ordinary, that's abusive, that's harassing. And the message, while distinct, it is meant to help people, to connect them to resources so that they don't have to choose any drastic choices that wind up with a baby in a trash bag like we just saw. I'm really surprised that this truck was out here right when I showed up already at 9 a.m., 9:15 a.m. or so, because in the previous 2 weeks, it was around 10:45, maybe 11:15. I have timestamps in my camera for those past two occasions. But yeah, doing this work, your brain really has to compartmentalize and go to different places. But, you know, in terms of not having an upset reaction while knowing what's most likely inside those bags, at least, you know, I did the math with 1,200 abortions across 6 different health facilities in San Francisco every year. That was a number noted by the mayor's office and the board of supervisors in a couple documents. That would mean that if evenly distributed among the 6 facilities, that there would be 3.4, or somewhere between a number between 3 and 4 bodies per week at each facility. So more likely than not, because this is a facility that advertises and tallies the number of elective abortions they do, that there's very likely, on average, potentially 3 bodies in those bags right there that we just saw. And just being able to state that very, like, the data centered, as I just did, that's only because, you know, your brain just has to compartmentalize things in order to get the facts out and share with the people who need to know. And from there, we can take our, let our voices go in the direction of passion, emotion, advocacy, and do all the things within, you know, the moral framework to end this practice. So thank you so much, guys, for listening. I'm gonna get on with starting my sidewalk outreach. I haven't seen any patients yet coming up or downhill. There is the truck driving off. So yeah, that was just such a happenstance thing that they were here right in the 9 o'clock hour when I began my outreach. I did plan to be ready with my camera whenever they did show up, whether it was going to be 10:30 or 11. But yeah, so that's out of the way. I can focus just on the parents now, and I'm grateful for that. So take care, everybody, and keep up the faith that we can create a culture of peace where no one is in harm's way. That is core to our ethic as well as our vision for the future. Don't go back on it. Let's just advance in affording everybody their right to life, safety, security. Thank you, guys.